Hello, my name is Dr. Ominde, and I'm going to discuss the anatomy of the palate in this lecture series. So the palate is actually what forms the roof of the oral cavity. So this is the oral cavity. So anything above the oral cavity is the palate, and it's usually a structure that separates the oral cavity from the nasal cavity above. So it's made up of two parts. The anterior part is bony, so we call it the hard palate, and the posterior part is muscular, we call it the soft palate. So the hard palate forms the roof of the oral cavity and floor of the nasal cavity. As we have said, it separates the oral cavity from the nasal cavity. It's formed by two structures. Anteriorly, by the palatine processes of the maxilla, right and left. So this and this, palatine processes of the maxilla, and posteriorly by horizontal plates of palatine bone. So those are the two components of the hard palate. And it's bounded on the outside portion by alveolar arches, which contain alveolar processes housing the teeth. So posteriorly, the hard palate is continuous with the soft palate, which is muscular, and the undersurface of the hard palate is covered by mucoperiosteum, and usually it shows transverse ridges anteriorly. So you can appreciate the transverse ridges anteriorly. This is the mucoperiosteum, and there's usually a palatine raphe between the right and the left side. The soft palate is the continuation of the hard palate posteriorly. However, it's not bony, it's muscular, and it's also covered by mucous membrane. Hard palate was covered by mucoperiosteum. Remember, periosteum is a covering of bone, so it's periosteum with mucous membrane on it. The soft palate is covered by periosteum. What are the components of the soft palate apart from muscles? We have aponeurosis, lymphoid we have submucous glands, and neurovascular structures. So the soft palate is formed by muscles, as we have said. We have neurovascular structures and lymphoid tissue, as well as an aponeurosis that covers it. So the palatine aponeurosis is just a fibrous sheath. Palatine aponeurosis is made up of a fibrous sheath that's attached to posterior border of the hard palate. Then it usually has an expanded tendon of tensor veli palatini muscle, as you can see here. This is levator veli palatini, and this is the tensor veli palatini muscle. Okay, and this is the palatine aponeurosis. So palatine aponeurosis, then levator veli palatini muscle, the tensor veli palatini. So levator veli elevates the soft palate. Tensor veli makes it tenses the soft palate. This is the palatine aponeurosis running across. Then you have your palatopharyngeus muscle here, the uvula containing musculus uvula in it. This is the uvula. When you open the mouth at the center above, there's usually a projection in the midline, that's the uvula. And on the sides, you have palatopharyngeus running through. So this expanded tendon of tensor veli palatini comes from the palatine aponeurosis. Then the palatine aponeurosis splits to enclose muscularis uvula, and it also gives an origin and insertion to the palatine muscle. So this palatine aponeurosis serves as origin and insertion for palatine muscles, including tensor veli palatini, palatopharyngeus, muscularis uvula. Okay. So tensor veli palatini originates from the spine of the sphenoid and the auditory tube, and usually inserts at the palatine aponeurosis. Okay, then it tenses the soft palate, while levator veli palatini is from petrospathotemporal bone, the auditory tube, and the palatine aponeurosis, and then it also inserts onto the palatine aponeurosis. So you can see it will come from petrospathotemporal bone and auditory tube, and it starts on the palatine aponeurosis. So levator palatini, it elevates the soft palate. Then muscularis uvula is from posterior border of the hard palate and inserts on the mucosa of the uvula. Posterior border of hard palate inserts on the mucosa of the uvula, and its action is to elevate the uvula. The palatoglossus from the palate to the tongue, palatoglossus. Yeah. So palatoglossus, as you can see here, it originates from the palatine aponeurosis, and inserts on the side of the tongue. So when it contracts, it elevates the tongue by pulling the root of the tongue upwards. So if it contracts, you tend to pull the tongue upwards, and it helps to narrow the oropharyngeal isthmus, so to narrow the oropharyngeal opening. The palatopharyngeus muscle, on the other hand, palatopharyngeus from the palate towards the pharynx, okay? So this is your soft palate. This is palatoglossus from the soft palate to the tongue, palatopharyngeus from the palate towards the pharynx. So it comes from the palatine aponeurosis and inserts on the posterior border of the thyroid cartilage, and it elevates the walls of the pharynx. So those are the muscles of the palate. What's the sensory supply to the palate? Mostly maxillary nerve through greater palatine and lesser palatine, as well as nasopalatine. So the hard palate, the region of the hard palate, you have maxillary nerve giving nasopalatine branch, greater palatine branch, and lesser palatine. While towards the soft palate region, you have glossopharyngeal nerve that provides a sensory nerve supply. So when you're asked to write about the gross anatomy of the palate, that's how you are supposed to divide the discussion. Then what's the motor nerve supply? All muscles of the palate are supplied by the pharyngeal plexus except tensa veli palatini, which is supplied by nerve to medial pterygoid, which is a branch of the mandibular division of the trigeminal nerve. Remember, we said the tongue, all muscles of the tongue are supplied by hypoglossal except palatoglossus, which is supplied by the pharyngeal plexus. Now we're talking about the palate. All muscles of the palate are supplied by pharyngeal plexus except tensa veli palatini, which is supplied by the nerve to medial pterygoid, which is a branch of the mandibular division of trigeminal nerve. What's the blood supply of the palate? Again, you have mainly the maxillary artery. Remember, maxillary artery is one of the terminal branches of external carotid arteries. So the maxillary artery gives greater palatine, lesser palatine, and sphenopalatine arteries. So it gives greater palatine, lesser palatine, and sphenopalatine arteries anteriorly, and these supply the palate. The palate is also supplied by ascending palatine branch from facial artery, and facial artery is from external carotid artery. So you have ascending palatine from facial artery, and also directly from external carotid artery, the ascending pharyngeal artery. So the palate is majorly supplied by external carotid artery, through which branches maxillary artery, which gives greater palatine, lesser palatine, and sphenopalatine. External carotid also gives facial artery through ascending palatine branch to the palate. External carotid artery also gives the ascending pharyngeal artery that will supply the palate. What are the clinical correlates? So when you do the embryology of the face, you will understand how cleft lip and cleft palate comes about. So you can have a unilateral cleft palate, or this includes cleft lip and cleft palate. As you can see, the lip and the palate are involved. There is a cleft. So when you have abnormal fusion of the different prominences that form the face, or prominences that form the maxilla, you tend to get the cleft palate. So abnormal fusion of the prominences. Then you can have paralysis of the soft palate. When you have paralysis of the soft palate, it's going to impair swallowing and speech. Okay, so this is your pharyngeal isthmus. Okay. So in the next lecture, we shall discuss the anatomy of the